February is Heart Month, and Della Ventura is an exercise specialist with Niagara Health's Cardiac Health and Rehabilitation Program. David brings us some tips for a healthy heart, and David, it all begins with exercise, your specialty.
That's correct. That's what I preach, and that's what we see the biggest difference in when patients are exercising. Their risk gets reduced of having another heart event or an initial heart event. And I find that it really makes a big difference in well-being as well. But a lot of people think that exercise is, just doing things around the house, or their work may be considered exercise. But it really takes an effort in getting your heart rate up about 20 to 30 beats higher than what your resting heart rate is. To be considered exercise.
What kinds of things do you recommend for patients dealing with heart issues?
Well, it could be very simple, just something as easy as walking. It's very cheap. You don't have to buy any exercise equipment. You can do it outside. If the weather's bad, there are a lot of places in Niagara that have indoor walking tracks. And it's just a matter of keeping track of your heart rate and making sure you're not overdoing it and trying to accumulate a minimum of 150 minutes per week.
Diet, regular checkups, stress, those are some of the other things that are recommended for heart patients?
A healthy diet always helps. Watching the calories that you're taking in, making sure you're burning off the same amount of calories. Stress plays a big role as well. It's kind of the hidden risk factor. In our program, we have a social worker that we can connect with the patient to help out. Also with diet, making sure that obviously you're eating the healthiest of foods, heart-healthy foods. I do know that the Heart and Stroke website has a list of hundreds of recipes on there for any type of meal, breaking it down into like breakfasts, lunch, snacks, and then even breaking it down even further into vegetarian beef, pork, or chicken.
Your rehabilitation program, the cardiac rehabilitation program, how does a patient get referred to that?
Most of the times it's pretty much automatic. Someone has a heart event and they'll go to the hospital and get treated. As soon as they come to the hospital, an automatic referral is generated to our program, letting us know that that person has had an event. And then from there, our clerks take over and our team will communicate with that patient, inform them of our services and what choices they have, a supervised exercise class, dietitian classes, and even help with stress management. And all those things are available for free to the patient.
Let's look at that supervised exercise class. What does that look like?
So the patients, when they select that as a choice, we have a facility that we go to that's located on the Brock campus. It's a facility that has a whole bunch of different cardio and resistance exercise machines. The patient has the option of coming in twice a week for about an hour-and-a-half class where they're supervised by the exercise specialist like myself and also a registered nurse at the same time. So it's a place where they can feel safe and get the exercises that we prescribe to them and making sure that they're not overdoing it. And then as they progress in the program, we progress their exercise program to fit their needs.
It all is tailored to their exact needs too, because you're dealing with people with a number of different possibilities of heart events, as you call them.
Exactly. We've had patients come in a wheelchair. We had patients come in that are on oxygen. We have patients come in that have mobility issues. So we tailor their exercise program to whatever we can, whatever they can do in the class. And there's a whole variety of different things we can do if they cannot use the equipment as well.
Do you also offer some services remotely?
Yes. With the pandemic, our program became fully virtual when there was no gyms open in the region, and we decided the best way to communicate with the patients was via phone. So we were offering all of the services we were giving them in person. over the phone. So we had dietitians phoning them, we had exercise specialists phoning them, and the nurses phoning them on set appointments.
Are there things that people can do to avoid having to, use the services of the rehab clinic?
Always. Staying healthy, eating right, getting enough exercise, but also if they do tend to notice symptoms where they're not able to do the things they were able to do before, or they're starting to get symptoms where they're feeling more fatigued doing them.
Shortness of breath,
chest discomfort. The symptoms vary in individuals. The best thing to do is contact your doctor and, get them to get you to see a specialist like a cardiologist.
NiagaraHealth.ca for more information on this. David, thanks
Yes.
for joining us today.
Thank you very much.